This is the Coronavirus Morning Report for Friday, April 17th, 2020. I'm Brian McCullough. As was widely expected, China has revised official COVID death numbers upwards. A deep dive into the positive test rate and why we should be cautious about U.S. case numbers plateauing. Potentially really terrific news about a drug treatment we've discussed before. How far can air carry the coronavirus? And with these terrible unemployment numbers, once again, why not put people to work doing testing and tracing? The official Chinese government death toll reported from Wuhan, the epicenter of the outbreak in China, has been revised upward by 50%, quoting the New York Times. Faced with mounting skepticism over its official figures, China on Friday revised up its death toll in the central city where the coronavirus first emerged. Officials in the city, Wuhan, placed the new tally at 3,869 deaths, an increase of 1,290 or 50% from the previous figure. The number of confirmed infections in the city was also revised upward to 5,333, an increase of 325. Officials in Wuhan said the revised death toll now includes those who died at home in the early days of the outbreak, as well as deaths that were not properly reported by hospitals or registered on death certificates, end quote. The city of Tokyo reported another record day of new cases, 200 additional ones on Friday. New Zealand's number of new cases shrunk to the single digits for the first time over the last 24 hours. Leftover fabric from the AIDS memorial quilt is being used by volunteers with the organization responsible for the quilt to make new coronavirus cloth masks. A roundup of charts from the various trackers. Dr. Scott Gottlieb tweeted charts overnight that he says show signs of slowing COVID-19 case growth in Texas, especially in the hard-hit Houston area, and also in the state of Florida. But at the same time, Ryan Struck at CNN, who tracks this every day, pointed this out on Twitter, quote, "In order to be on track for around 70,000 U.S. coronavirus deaths in the latest University of Washington model cited by the White House, the model would expect 29,902 total U.S. deaths as of today. The current death count is 33,268. The latest University of Washington model cited by the White House would not expect us to hit 33,300 U.S. coronavirus deaths, the approximate current death count, for 2 more days in order to be on track for around 70,000 total U.S. deaths," end quote. I just did a shorter top news segment this morning because I wanted to spend some time on this. One of the biggest reasons I've been so cautious about all of these numbers coming in indicating that cases have plateaued here in the U.S. and elsewhere, because at the same time I kept hearing people whisper, yeah, but the case numbers are not dropping significantly yet. Remember, I said maybe a week ago, U.S. leveling off in cases, Europe leveling off in cases, New York even leveling off in cases is good news, but very few locations have gone into reverse in a sustained, consistent way yet. And that made me think that we're not out of the woods yet. And when you consider that death numbers are still rising in a lot of places, I'm worried now that we're so eager to get back to life as normal that we're kind of declaring victory a bit prematurely. It's that lack of numbers dropping that really sticks in my head because I haven't heard a decent explanation as to why we've plateaued but not started dropping, especially because several people have also been pointing out that the number of tests in the U.S. leveled off at exactly the same time. Are the numbers in terms of cases only plateauing because our testing capacity has hit its limits? As I said, people have been asking this all week, and I hadn't seen any good answers. Well, last night, The Atlantic delivered what might be an answer. According to data from its COVID tracking project, which is an effort to watch numbers state by state, day by day, they've tallied the last few weeks and days up, and they've come to the conclusion that 1 in 5 people who get tested for coronavirus in the U.S. test positive for it. This is called the positive test rate. What does that mean? Does it mean that 20% of the population has COVID? No. That would be a metric called incidence. Incidence tells you the proportion of people infected in a given population. We don't know the incidence rate yet. The positivity rate tells you how bad the outbreak you're encountering in a given region is. Positivity rate can be explained this way, quoting from the piece. If the U.S. were a jar of 330 million jelly beans, then over the course of the outbreak, the healthcare system has reached in with a bigger and bigger scoop. But every day, 20% of the beans it pulls out are positive for COVID-19, end quote. All right, is that good or bad? It turns out it might be bad. The U.S. did 25 times more tests on April 15th than it did on March 15th. And yet the number of positive test results keeps holding steady. You can actually see this for yourself. Pull up graphs on the internet from just about anywhere. The number of new positive cases has held steady in a given range for about a week now, more or less. But Brian, that's good news, right? That means we've flattened the curve. We've hit a plateau. This is what we've been waiting for. That's why people are talking now about coming out of lockdown. How could that not be good news? Well, here's why. Remember what I said. We keep scooping those jelly beans each day and keep getting 20% infected jelly beans. The fact that we keep getting roughly the same numbers means that the severity of the outbreak is not yet declining. As the piece points out, if the disease was coming under control, if the disease was truly plateauing and beginning to fade away, then as we did that daily scoop into the jelly beans, the number of positive cases should start to slip. If we're seeing 20% now, we should see 19% over the weekend, and then 15% or 12%. And it should do that because, remember, we're finally testing consistently and in big numbers. So let me further the analogy to explain more. We're scooping jelly beans every day, right? And when we find infected jelly beans, let's call them red jelly beans, we're isolating them. We're keeping them from infecting others. So as we find these red jelly beans, we're taking them out of circulation, and over time, there should be less of them. Like if you were scooping and only looking for red jelly beans in a jar, and every time you found one, you took it out, eventually, one day you'd scoop and there would be less reds, and less reds, and less reds, and maybe even one day no reds because you'd taken them all out. But we're not seeing that. We're scooping each day and seeing the same numbers, roughly 20% red jelly beans. That suggests that there are actually more red jelly beans in the jar. We're just not scooping them all out every day. That suggests that there's this whole unknown reservoir of infected jelly beans that we aren't grabbing. Because if we had 2 scoops available every day instead of 1, they'd be pulling out 20% red also. If we had 3 scoops or 4 every day, we'd have the chance to grab more of those 20% red ones. So this is the problem. This is sort of what I feared. We might be plateauing only because we've reached the capacity of scooping. Our scooping has plateaued. Quoting the piece again. Since April 1st, the country has tested roughly 145,000 people every day with no steady upward trajectory. The growth in the number of new cases per day and the growth in the number of new tests per day are very tightly correlated. This tight correlation suggests that if the United States were testing more people, we would probably still be seeing an increase in the number of COVID-19 cases. And combined with the high test positivity rate, it suggests that the reservoir of unknown, uncounted cases of COVID-19 across the country is still very large, end quote. In other words, U.S. cases plateauing, the very reason we've been hopeful recently and the very reason we're getting ready to reopen society might only be happening because we've reached our upper limit of testing. So we might be about to throw the doors to the country open again, not knowing that there's this whole reservoir of disease still out there, potentially much larger than our plateauing numbers are showing us. Let me tell you another reason why that 20% positivity rate is problematic. It is actually very high. Again, we've said this countless times. The U.S. and South Korea both reported their first cases of COVID-19 on the same day. And coincidentally, right now, both countries have tested around 1% of their populations. But the U.S. has a 20% positive rate, as I said, and South Korea has a 2% positivity rate. Italy, perhaps the hardest hit country thus far in Europe, only has a 15% positivity rate. 5 entire states in the U.S. have 20% positive rates: Michigan, Georgia, Massachusetts, Illinois, and Colorado. Lombardy, the hardest hit part of Italy, it has a positivity rate of 28%. Meanwhile, New York State has a positive rate of 41%, and New Jersey's might actually be 50%. Quoting again from the piece, the U.S. test positivity rate can't yet provide much detailed information about the contagiousness or fatality rate of the disease, but the statistic can still give a rough sense of how bad a particular outbreak is by distinguishing between places undergoing very different sizes of epidemics, Andrews says. A country with a 25% positivity rate and one with a 2% positive rate are facing, quote, vastly different epidemics, he said. And the 2% country is better off, end quote. In other words, here in the U.S., we're about to throw the doors back open in this country, despite the fact that we are staring down the barrel of the worst outbreak currently in the world, and it's currently still ongoing. Quoting from the piece one last time, countries that test broadly should encounter far more people who are not infected than people who are, so their test positivity rate should be lower, end quote. Well, we're testing broadly now, or at least as broadly as we can, and we're not seeing that. Numbers are plateauing, but plateauing is different than dropping, especially if that suggests that there's this deep reservoir of unknown cases still out there at this moment. To borrow another metaphor, we're throwing the doors and windows of the country open, not knowing that the worst of the storm that we've all been sheltering from all these weeks is not only still out there, not only not fading, potentially the worst of the storm is actually right now. So after that, we could certainly use some good news, right? I know I could. Here's some potentially really good news. Coronavirus patients may be responding successfully to remdesivir, an antiviral drug manufactured by Gilead Sciences, early data suggests. The publication Stat has revealed that nearly all the patients in a clinical trial underway at one Chicago area hospital have made rapid recoveries from severe COVID-19 disease and have even been discharged. Results from Gilead's clinical trials are expected within days, and if remdesivir is found by the FDA to be safe and effective, it would be the world's first approved drug to treat coronavirus. And I should underline that, treat, not cure. Quoting from Stat, the University of Chicago Medicine recruited 125 people with COVID-19 into Gilead's 2 phase 3 clinical trials. Of those people, 113 had severe disease. All the patients have been treated with daily infusions of remdesivir. Quote, the best news is that most of our patients have already been discharged, which is great. We've only had 2 patients perish, said Kathleen Mullane, the University of Chicago infectious disease specialist overseeing the remdesivir studies for the hospital, end quote. Cautionary note, these results are just one snapshot from a number of clinical trials underway. Mullane herself said it was hard to draw conclusions from the data because the trial in question did not include a placebo group. But she noted, according to Stat, quote, we do see when patients do come in with high fevers, they do reduce quite quickly. We have seen people come off ventilators a day after starting therapy. So in that realm, overall, our patients have done very well, end quote. She added, quote, most of our patients are severe and most of them are leaving at 6 days. So that tells us duration of therapy doesn't have to be 10 days. We have very few that went out to 10 days, maybe 3, she said, end quote. Eric Topol, director of the Scripps Research Translational Institute, told Stat that the results were encouraging, adding, quote, the severely hit patients are at such high risk of fatality. So if it's true that many of the 113 patients were in this category and were discharged, it's another positive signal that the drug has efficacy, end quote. This is potentially great news because we all know the silver bullet is a vaccine. We're all waiting on that. But if we had a treatment that kept the disease from being super serious and fatal, that might suffice for the time being. Obviously, it's way early to know if this is that, but again, good news where we can get it, right? Hope for a vaccine, and while we're hoping and waiting around for that, hope for an effective treatment as well. Being stuck at home these days, You're probably not thinking too much about internet privacy because you're on your own home network. Fire up incognito mode on your browser and no one can see what you're doing, right? Wrong. Even in incognito mode, your online activity can still be traced. Even if you clear your browsing history, your internet service provider can still see every single website you've ever visited. That's why even when I'm at home, I never go online without using ExpressVPN. ExpressVPN makes sure your internet service provider can't see what sites you visit. Instead, your internet connection is rerouted through ExpressVPN's secure servers. Each ExpressVPN server has an IP address that's shared among thousands of users. That means everything you do is anonymized and can't be traced back to you. ExpressVPN is the fastest and most trusted VPN on the market. It's rated number one by CNET, Wired, The Verge, and countless others. So protect your online activity today with the VPN that I trust to secure my privacy. Visit my special link at expressvpn.com/report, and you can get an extra 3 months free on a 1-year package. That's expressvpn.com/report. expressvpn.com/report to learn more. Are you spending more time inside and alone than usual? A lot of us are. It's easy to get stuck in anxious thought loops when that happens. Worst case scenarios, what ifs, ruminating about the past, or projecting into the future. Talkspace Online Therapy can help you find the support and guidance that you need to feel less alone. Simply match with one of Talkspace's licensed therapists from the comfort of your phone or computer. You'll get secure support when you need it, wherever you are. We all need to talk through life's challenges, and Talkspace offers the safe space and support that we deserve at a price we can afford. Right now, you can match with your perfect therapist at Talkspace and get $100 off your first month with promo code BRIEFING. Sign up at Talkspace.com or download the Talkspace app. Don't forget to use promo code BRIEFING for $100 off your first month with Talkspace. We all know that coronavirus spreads via droplets that people expel when they cough or sneeze. A while back, we discussed the concern for healthcare workers that the virus could also be spread through smaller droplets called aerosols during certain medical procedures like intubation. Now we're starting to get more information on aerosol spread and more context on the recommendation to keep 6 feet away from other people. The reason the CDC recommends keeping 6 feet of distance is because most large infectious droplets tend to fall to the ground within 6 feet after being launched by a cough or a sneeze. But that's still not a perfect measurement that will create some sort of contagion-free bubble around you. The New York Times pointed to a recent study that suggests sneezes can actually propel droplets much further than 6 feet. And there's also the potential threat of aerosols. Quoting the New York Times, aerosols are generally considered to be particles under 5 microns in diameter, about the size of a red blood cell, and can be spread in the environment by talking and breathing. But some researchers argue that this is a false dichotomy. Infectious droplets can't easily be divided into those that are big enough to fall to the ground quickly and those that stay aloft, because so much depends on environmental conditions and how deeply they penetrate into the respiratory tract. A preliminary study at the University of Nebraska Medical Center found evidence of coronavirus genetic material on various surfaces in isolation rooms where infected patients were being treated, including on air vents more than 6 feet away from the patients. The research, which has not yet been peer-reviewed, indicates that the virus can occasionally travel long distances. Quote, "The virus is so small, it can hitch a ride even on tiny, tiny particles." Dr. Feinberg, the head of the Standing Committee on Emergency Infectious Diseases and 21st Century Health Threats at the National Academies of Sciences, Engineering, and Medicine, said, "But how important is each size and how well they can transmit disease is not fully understood," end quote. It is also unclear how many virus particles it takes to start an infection, how long the viral particles remain viable, or if studies like the one in Nebraska simply detected the genetic calling card of the virus left behind, end quote. Even without studying COVID-19 specifically, the New York Times points out that studies of influenza have shown even infected people with mild or no symptoms can spread infectious droplets when they speak or even just breathe. Quoting again, "An infected person talking for 5 minutes in a poorly ventilated space can produce as many viral droplets as one infectious cough." Quote, "If there are 10 people in there, it's going to build up. said Pratim Biswas, an aerosols expert at Washington University in St. Louis, end quote. That might all make any preventative measures sound futile, but the doctors the New York Times spoke to said it's all about probability and reducing risk. Simply by remaining 6 feet apart, there are less people that can be in a room, and therefore it's less likely that someone in that room is infected, and if someone is, because everyone is spaced far apart, it's less likely anyone else will catch it. Dr. Harvey Feinberg says, quote, 3 feet is better than nothing. 6 feet is better than 3 feet. At that point, the larger drops have pretty much fallen down. Maybe if you're out of spitting range, that could be even safer, but 6 feet is a pretty good number, end quote. And don't forget about masks. While they're mostly to protect you from spreading the virus to other people, they can also prevent large droplets from landing on your nose or mouth, even if they can't necessarily stop you from inhaling the smaller aerosol droplets. Again, all of this is about reducing risk, not completely eliminating it. It's about reducing the amount of virus you potentially ingest, not just not ingesting any virus at all. If you want a visual on all this, the New York Times created a 3D simulation to show how large and small droplets travel when someone coughs or sneezes and how that changes with a mask on. They also have a cool augmented reality feature in their app that helps you measure 6 feet around you when you have to go out and about. Link, as always, is in the show notes. Finally, today, we've talked a lot about potential technological solutions to contact tracing this week. Apple and Google's new collaboration, for example. But states and countries keen on reopening their economies are also starting to invest in a more manual approach, actually hiring people to do the shoe leather work of going out, contacting people who have been in contact with coronavirus positive people, and getting them to take appropriate distancing or quarantining measures. Quoting the New York Times, contact tracing has helped Asian countries like South Korea and Singapore contain the spread of the virus, but their systems rely heavily on digital surveillance, using patients' digital footprints to automatically alert their contacts, an intrusion that many Americans may not accept. Massachusetts is building its response around an old-school, labor-intensive method. People, lots of them. It's not cheap, Massachusetts Governor Baker said, but the way I look at it, the single biggest challenge we're going to have is giving people confidence and comfort that we know where the virus is, end quote. The state is currently experiencing a surge of cases expected to last for the next week, after which it may start to consider easing social distancing rules. Robust contact tracing combined with ramped-up testing could smooth that process, the governor said. It's hard to see how we create a sense of safety if we don't have a program like this in place, he said, end quote. Massachusetts isn't alone in this endeavor. Ireland is putting 1,000 furloughed public sector employees back to work doing contact tracing. Public health medicine specialist Dr. Sarah Doyle explained to the Irish Times how the process will work there. Quote, the trigger for the contact tracing comes when public health authorities are officially notified by laboratories of the identity of a person who has tested positive for COVID-19. Dr. Doyle says individuals with confirmed cases will be taken through the official advice for the condition, including infection control and self-isolation. They will be asked to think about those they had close contact with since they started to develop symptoms. She says these are defined, based on European public health advice, as being people with whom there was face-to-face contact within 2 meters for 15 minutes, or those with whom 2 hours was spent in the same room. By the way, 2 meters is roughly 6 feet. Dr. Doyle says that if the individual concerned worked, for example, in a healthcare location, a prison, or other setting involving large numbers of people in close confinement, their case would be considered to be complex and would be managed directly by their local Department of Public Health. In other circumstances, the person would receive a second call to go through the details of the contacts they were asked to try to recall. The second caller will record the names and contact details of individuals identified by the person with the confirmed case, and this information will be logged in the IT system of the health authorities and used as the basis for the third part, the tracing exercise. The third call will involve contacting people and advising. The third call will be going out and contacting people and advising them they had been in contact with a person who had contracted COVID-19, end quote. That person would be advised to self-isolate and get coronavirus tests if they're symptomatic. If they have no symptoms, they'll be told to restrict their movement for 14 days. But again, It requires actual human labor to go out and do that. Here in the U.S., former CDC Director Thomas Frieden has recommended the recruitment of an army of 300,000 people to do such contact tracing nationwide. Given the number of people currently out of work, that would seem achievable, and the related expense would surely be offset by our being able to operate a more open economy more consistently. And although digital components may be integral and integrated to this process as they become available, the human factor remains important, according to Paul Farmer, a physician anthropologist who co-founded Partners in Health, the nonprofit group running Massachusetts' program. He told the New York Times, quote, "Somebody needs to say to people who are worried and not feeling well, we got you. If this is COVID-19, we got you, and we'll look out for your contacts, your spouse, and your children," end quote. If you had a program in place that gives people confidence, then they will return back to work with confidence, and the economy will roar back like we're all hoping. And all of the millions of people currently out of work now, a lot of them could be given a paycheck right now when they need it the most. And they could be given a meaningful role contributing to society in this difficult moment. This is such an appealing option, especially when there are so few other options for unemployed people at the moment. It's hard not to see how this wouldn't just be one hell of an economic win-win-win coming and going for just about everybody. That's all for this week. I've been Brian McCullough. This podcast has been produced by Ride Home Media. Search your podcast app for Ride Home if you want to check out some of our other daily news shows from our network this weekend. Be well, everybody. Talk to you on Monday.